Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. If you needed to see your doctor in the past year or so, I'm guessing that you were reluctant to go to their office or to the clinic to have that in-person visit with your primary care physician. Instead, a lot of us probably were doing video chats or telephone conversations with our PCP to help resolve our healthcare needs and issues. And this is something that was in place long before the pandemic hit. So we've had telepharmacy, telemedicine, telehealth going on prior to the pandemic, and really was trying to get started and take hold as we were seeing underserved communities, issues with patients traveling, getting to the clinic. Really, it was inconvenient and a lot of times really not possible. So telehealth was really coming into play years before we saw the pandemic hit. And of course, when the pandemic did hit, then all of a sudden telehealth just took off. So I wanted to talk today about specifically this topic of telemedicine, telehealth, and of course, within that is telepharmacy. And I recently saw two articles. So in this Journal Club episode, I want to cover those two articles that were written last year and talk about telemedicine. So let me bring up the presentation and we can talk about these topics that are very important and a direct pharmacy informatics topic that we want to discuss. So again, this is at the AJHP website, and as I mentioned before in a previous episode, these are the top 25 articles that were downloaded from the website in 2020. Now, two of the articles had to do with telemedicine or telehealth. So the first one here is a letter to the editor, and it's about the use of telemedicine to provide clinical pharmacy services during the pandemic. And these folks talk about things that they were able to accomplish during the pandemic, such as, number one, patient education. So telepharmacy, counseling the patient, educating the patient via video or telephone conversation. And then reviewing the patient's profiles and medication histories remotely, providing MTM, medication therapy management, and then drug utilization reviews. So these are the things that they highlight in a letter to the editor about telemedicine, using that tool and what they were able to accomplish via telemedicine during the pandemic. The second article is about establishing clinical pharmacist telehealth services. So this is specifically telepharmacy during the COVID-19 pandemic. And what they discuss in the article is, number one, regulations were quickly changing. As we know, during the pandemic, there was a lot of push to have pharmacists more involved with therapy, providing therapy remotely, and being reimbursed for that visit. So this is something that really helped us and really helped us blossom telepharmacy, providing services to our patients, getting reimbursed for those services, and being able to take care of them without that in-person visit. Now, there are a lot of advantages, and this is why I think that even after the pandemic passes, after we kind of get the situation with the COVID-19 virus under control, it may take time, but we're going to get there. And even after we do get that control of this situation, I believe that telepharmacy services will still stay strong and continue to be in place because of the flexibility with scheduling appointments for education, for all types of clinic visits that we do, for oncology, pain management, anti-coag, and other specialty care. So this is something that, again, was starting a long time ago. We've seen it really grow tremendously during the pandemic, and I feel that it's going to stay and continue to be a strong tool for us as we move forward. And then I think that for them, they're saying that phone visits were the best in terms of getting a good understanding of the patient and building rapport. So whatever method that you use, whether it's video chat or telephone, whatever works, it's something that would be worth paying attention to and seeing from surveys or immediate feedback what's working best for your patients. And then, of course, use that tool that's the most effective. But this all falls under telepharmacy. And I think that for the pharmacy informaticists, it's good to read these couple of articles to really focus in specifically on what has happened during the pandemic and what is likely to be an ongoing pharmacy informatics tool for us to provide optimal therapy in the future. If these article reviews were helpful for you, then please like the video and subscribe to my channel, and I'll thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others. I'll continue to work on more episodes, and I do hope to see you next time. Take care.